Cervical cancer involves a disease where there's abnormal growth in the cells of the cervix, which is the very lowermost part of the uterus. So it is a disease that affects women and is one of the most common reproductive cancers in America. Typically, in earlier stages of cervical cancer, it is asymptomatic, so there are no early warning signs. It's usually when it's more advanced that women may experience abnormal bleeding or discharge, so certainly those are instances where it needs to be evaluated. HPV stands for the human papilloma virus. There's over 200 different strains of this virus. HPV is primarily spread through direct contact, primarily sexual contact, and it's the primary cause of cervical cancer, causing over 99% of the cases. The HPV vaccine is the only vaccine that is actually able to prevent cancer. So HPV vaccine has been out for over 15 years and has been highly effective in decreasing the rate of infection of HPV. So this is a vaccine that is given to people starting at age 9 up to age 45 that can help to prevent the transmission of this and overall decrease the rates of this type of cancer. It's important for both men and women to be vaccinated, ideally in their teens. And the reason for boys to be vaccinated as well is not only to decrease the overall spread of HPV, but HPV can cause other conditions other than cervical cancer, other types of genital cancers, and also certain types of head and neck cancers. Because early stages of cervical cancer don't always have symptoms, it's very important for women to get screening from their primary care provider or their gynecologist. Screening involves having a regular pap smear which detects abnormal cells because cervical cancer, especially when caught in its earliest stages, is very treatable. Many people, for several reasons, hold off on preventative care. Life gets busy, and particularly women who are often focused on caring for others, oftentimes forget about their own important health care. So it's great to have an ongoing relationship with your primary care provider and to make sure you're getting your regular recommended checkups.